All right, here we are. We are live. It is another Sunday night, and welcome in, everybody. I appreciate you all being here, and I have such a special show for you tonight. I have been wanting to have Dr. Sue Shoha on this show for a really long time. I think I've been saying that I've been wanting to have her, but we finally got her. So everybody give Dr. Sue a very warm welcome. And I want to tell you a little bit of story. Dr. Sue is what most people would consider a holistic dentist. And we're going to break that down and define exactly what that means in her world of dentistry and how she's helping people in a really unique way. But then also we're going to talk about how she and I, as a chiropractor and a dentist, are working together to help people in incredibly dramatic ways, more so than you can even imagine. And we're going to have a special guest on, and she's going to come on and tell her story because she's a patient of mine and a patient of Dr. Sue's. And you guys are just going to be blown a freaking way. So welcome, Dr. Sue, to the show. Thank you so much for being here.
Thanks for having me.
Yeah, I met Dr. Sue. I had no idea that there was a world of holistic dentistry, and I was invited to a holistic dental conference. And I'm on the plane, and these people next to me were asking me what I was doing going to New Orleans, and I was explaining to them I'm going to a holistic dental conference. And then I checked my Instagram, and there's this message, and she says, I'm going to the same conference. I'm sitting in the row in front of you. So she was sitting right in the row in front of me, heard the conversation. We got off the plane, and we're instantaneous friends. And after this interview, you guys are going to see why I absolutely adore her. So that is my story of how I met Sue. So Sue, just give us a little bit of background about yourself and this world of holistic dentistry and how you evolved into that place.
So I went to University of Michigan and got Go Blue.
Yes.
Got a great foundation in conventional dentistry, and I just have a lot of gratitude for that. But it wasn't until I had my first child that I had a run-in with conventional medicine, where I was having a hard time losing weight. I would just sit at the table with my head in my hands, just knowing something was wrong. And the docs wanted to put me on Paxil, and they wanted me to take all these chemicals, and it just didn't sit right with me. And it was at that time that I started seeing a holistic physician. And one of the first things that he said to me was, I think your tissues are acidic. And I had no idea what that meant. I was a good student. I, did well in chemistry. I had no idea what that meant. And he slowly helped me turn my life around, which is why ever since I've had children, and I was always really fit, I was working out all the time. But it wasn't until I changed my diet, my lifestyle, just added more fats, added more protein, just changed up just taking different supplements. And there came a point in time where I felt this need to integrate my lifestyle with my work. And conventional dentistry, as you know, consists of using a lot of toxic materials, whether it's mercury or fluoride or even implants. There's just so many different materials that are used that are just not good for you, which is why when I made that jump and I decided to start treating patients professionally the way I was living in my personal life, and everything changed. So, just got this really nice practice in Bloomfield where they're like-minded people that really, they choose to come, they drive, they fly, all kinds of things.
How many years ago was that, Sue, that you made that shift?
Oh, it's probably, I've been doing holistic dentistry for about 15 years or so, but I started this practice in Bloomfield about a little over 10 years ago.
And when you made that shift from traditional dentistry to holistic dentistry, did you lose people? Obviously you gained people. What was that like from a business perspective? Was that like a complete disruption for your practice and for your people, or were you able
Well,
to get people to start to change how they think?
that's such a great question. At that point, I actually just started from scratch with no patients, and I just jumped right in because it was just the right thing to do. But I'm finding that very conventional thinking people, once they are given the education and the information to make the choices for themselves, it's a no-brainer. If you tell somebody that a mercury filling is 50% mercury and not 50% silver as they were led to believe, they're like, well, why would I want to have it in my mouth? So, just things like that, where the more information we give them, it's just a very clear choice.
Yeah, I still, when I take x-rays on people, it's called an open mouth cervical x-ray. So they have to open their mouth and I shoot the x-ray through their mouth to get a picture of the cervical spine, because for those listening, the jaw is such a heavy bone that you can't see the spine through the jaw. So open the mouth, take the picture. So when I have them open their mouth, I will always, and then of course I see it on the x-ray and I'll ask them, what's in your mouth? Because as you and I both
Great
know,
question.
even if they had these fillings years ago, they could still be off gassing. They could still be a contributor to some of their chronic health issues. So,
Absolutely.
yeah.
Especially
So,
when you mix different metals together. Often there's a mercury filling next to a non-precious, next to a gold, next to a titanium, and it creates this little battery in the mouth. And it's
isn't
just
that
2 inches
interesting?
away from, yeah,
Yeah, right from your brain. You're going right up to the brain.
exactly.
So no wonder we have cognitive decline, right?
Exactly.
I never asked you
Exactly.
this question before, but it's just, I feel like it's timely to ask with the conversation. We know that heavy metals in the brain are linked to cognitive decline, but have we connected oral metals to the heavy metals in the brain to the cognitive decline? Has anybody done those studies?
There is definitely a lot of literature showing that heavy metals are implicated in a whole bunch of autoimmune issues and, grabbing onto the enzymes that are required for methylation, for detoxing. So, absolutely, absolutely.
Idaho
But
Garden Growth says a metal battery in my mouth. Yeah, pretty much, right?
yeah, 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 exactly. Yeah,
I mean, when you think of it like that, and you think of it as a charge, and our bodies function on charges, we're all just a bunch of positive and negative charges, and so if you put something in your mouth that's going to then change the charge. I mean, it's like being around too many electromagnetic fields, sitting in front of these computers all day long, right?
yeah. This is just a lot of cross connection, and you lose a good communication. I mean, I have patients that come to me and they have been to several other people. I just am thinking of this lovely older lady who felt like she was hearing radio waves, and she had the whole slew of different metals, and we slowly systematically started switching those out to non-conductive materials, and she was just in tears. She's like, you gave me my life back. I thought I was going crazy, and it's
So
just a matter of switching things out. So it's really pretty amazing what
we
we can
just
do.
had a comment. Does it contribute to tinnitus?
Absolutely.
That's great to know. That is great to know, because so many people, I mean, how many people are walking around with tinnitus and just, know they're being given medications, and yeah, there are other ways. So,
And the
uh,
foil, yes, exactly.
mhm. Is there a directory of holistic dentists? We have somebody who's looking in the chat right now.
Absolutely. So if you look up IAOMT, that is an organization that lists holistic dentists all across the country as well as internationally. look for someone who's accredited, which means that they have gone and taken extra training to be experts in that field.
Great.
There's
I just
also
dropped that link.
IABDM.
Okay. What is the other one?
IABDM.
Okay. We'll drop these links here. So I think where I want to segue right now, this is great because I knew this was going to come up. How do I find a holistic dentist? So I just dropped the link there, Gil, and then here's the link to the other one. IAOMT, and then IA, B like boy, D like dog, M like Mary. So there's that. Yeah.
Yes.
So here's what's interesting, because I want to talk about just the definitions of holistic, and there's variations. And so I practice functional medicine. I have multiple certificates in functional medicine. So, you can call yourself a holistic chiropractor and be able to tell people to drink water and here's a multivitamin. But then for me, yes, I'm holistic, but I have all these certificates that really elevate my ability to care for people from a lifestyle, food, nutrition, movement perspective. So what does that, break that down for us in the world of dentistry, and tell us a little bit about your credentials. And I know you've trained under one of the best in the country. So I really want people to understand when they're going and looking, what they really should be looking for, and what that meant for you to get that particular credential.
So we're talking about holistic dentistry, or what?
Yeah.
What was your question?
Well, you were going to talk about how you got connected with Dr. Zaghi,
With
right?
Dr. Zaghi. Okay.
Yeah.
So about 15 years ago, I was doing a lot of frenectomies on babies, which really implies releasing tethered tissues to help babies breastfeed. And I happened to be at a meeting, AAPMD, where there was someone talking about frenectomies. And so I'm like, oh, it'd be great to, kind of add to my knowledge base. And I tell you, that one short little breakaway meeting changed everything for me, because Dr. Zaghi, who is Harvard trained, Stanford, UCLA, ENT, and he has been doing a lot of research and a lot of work in tongue mobility restrictions. He's a sleep surgeon. So really the basis of all of this is helping people sleep better, breathe better, live better. And he showed a video of an adult where he did a tongue tie release after evaluating and making, doing her sleep study and so on and so forth. And seeing the look on her face as she was being released, and you could just see her just sort of melting into the chair, and she could breathe better, and all these miraculous things. I mean, you could see it happening right as this release was going on, which is when I knew that I had to follow him to LA and learn more, which is what I did. And I actually chose to have my tongue tie released by him, and it was just an amazing experience. I mean, as he released, I could feel myself breathing better. I had the shoulder neck tension, which I thought was part of the kind of work I do where I'm bending over all day, and that disappeared just in a second. My gait has changed. My hips are level, and I used to have this pronated walk, and my gait has changed. I don't have that low back tension. It's just been amazing. So my daughter's had hers released, and I have spent a lot of time studying and training with him. So anybody that is, looking for information, they have a great website and lots of, good resources.
And we'll drop that into the show notes for you guys later. So let's go upstream a little bit, because I'm certain some people are listening and they're thinking, tongue ties, I thought that was just a thing babies had. So give us a little bit of, backstory when we're talking about oral tethers. What does that mean? And how does it affect people? Because I think everybody's going to be pretty shocked to discover that it affects things that it goes so deep. So talk to us a little bit about what it is, how we find it, and if people are, having some sort of chronic issues, maybe they should go have it checked or get checked for it. So give us that story.
So I think it's, right now there's just a lot of talk about oral restrictions, whether it's lip ties, tongue ties, buccal ties. And the biggest thing to remember when we're talking about this is that we're looking at not just what's visible, but the mobility of the mouth, of the tongue, of all the structures, because that is what affects function. And when we're looking at tethered ties, especially, say we're looking at a newborn, the tongue needs to be mobile enough to be able to lift up to the palate so a baby can breastfeed. And we are given this gift of being able to suck, swallow, and breathe without coming off the breast, which is why the tongue needs to be basically sucked up to the roof of the mouth. All right. And as the child grows, that tongue staying in the roof of the mouth is what causes the palate to grow. And the palate, which is the roof of the mouth, is really the floor of the nose. So as the tongue is up there, it's allowing everything to widen and broaden and allow good nasal airflow. So again, as we're looking at restrictions, it's more important to look at function and mobility and how we can make the proper assessment looking at that.
So one of my patients that I sent to you, it's probably been 3 years ago now. He was 13 and he was seeing me at, he was 13, 14, 15, something like that. I can't remember, somewhere. He was a teenager. Mm-hmm. He had a severe speech impediment and, he was very self-conscious of it. And I looked at him and I said, he has a tongue tie and so I looked in the frenulum, that tissue underneath the tongue was so big and it was tethering his tongue down. So, as I'm making those sounds, he can't do that. He's having a difficulty lifting his tongue. And then I sent him to Dr. Sue, and then they came back and the mom was so mad because they had been to speech pathologist, therapist after therapist for this boy. And she goes, I've been asking, does he have a tongue tie? And everybody said, no, he doesn't. And then I said, absolutely he does. I send him off to Dr. Sue. She's like, absolutely he does. We get a myofunctional therapy. He gets a tongue tie he gets a release. I mean, so it's amazing to me how something even that obvious can get missed. How does that happen?
Here's what's really sad. I have actually released ties on 2 speech language pathologists, and they didn't even know that a tongue tie and speech are connected, which,
wow.
I mean, even intuitively you think, and these women, both of them came from Ohio, so they crossed state borders to come and have a release. And it's mind blowing to me that, that's what we're dealing with.
Yeah. Yeah. You would think that, so from the obvious perspective, and then, the other things that people would never connect to is scoliosis. I've treated scoliosis for my whole 26 years. It's one of the primary things that I treat in kids and adults. So, curvatures in the spine. I always have great success, but now, after working with you, I'm like, how much more success can I have by checking them for a tongue tie? Because that's so incredibly connected. So talk about the fascia and how that affects everything down the spine.
So the fascia,
see if I can pull up that picture.
The fascia that is in the floor of the mouth, which is at the base of the tongue, connects all the way down to the tips of the toes, to the deep fascial plane. So everything is connected through this fascia, whether it's the diaphragm, whether it's the head, neck, and the shoulders, and the pelvic floor, the hips. So what's really interesting is as patients do the myofunctional work, as they have myofunctional or myofascial release done, as they have craniosacral along with chiropractic, they start noticing mobility and opening and limberness in different areas. And at some point we'll talk about the laser work that we're doing too, the Orlays and baby lays, that is specific wavelength of light that will go in and soften the fascia and allow for better function.
I'm unable to pull that picture up, but it's fascinating because if you just see the tongue, and then as it goes down, it's connected to everything all the way down. And so, we really have to pay attention to all of the things that are affected. One of the things that I work a lot with is vagal tone. So the vagus nerve is responsible for our rest, digest, and repair, actually our parasympathetic nervous system, which the vagus nerve is the primary part of that. We're in fight or flight all the time. And the vagus nerve, this reminds me of the vagus nerve, which is why it's so tightly tied to the tongue and oral health, because the vagus nerve starts at the brainstem and it goes all the way down and around all of the organs and the heart and the lungs and into the intestines. And it's responsible for rest, digest, and repair. And when you think of, you think of something, you get butterflies in your stomach, that's your vagus nerve, right? You think a thought and it, does something to you, and that's your vagus nerve. So, so these are, again, from a fight or flight perspective, chronic stress, issues that we can actually look at that impact looking at oral health. And why can't we get your tissues and your muscles to just relax? Obviously I put my hands on people all day long, and there's so much tension. I'll tell some people, I'm like, you feel like a concrete brick. Like, this is crazy how tight and tense they are. So I want to talk about, because we're going to have Lana on in just a few minutes. And so I want to talk about her story before we bring her on. And
I do want to say something, because we're talking about the nervous system, because really that's what it's all about. We're trying to be able to have a handle on our nervous system. When we are being chased by a tiger, we want to be able to get our heart rate up, get our breathing to support us. But when we're not in that point of stress, when we do want to relax, when we want to go to sleep, we want to be able to have the ability to go into that parasympathetic rest and digest mode, which is, again, where our breathing and our oral rest posture comes in. When our tongue is sitting up in the palate where it should be in ideal rest posture, it allows us to nasal breathe and assists with that. And nasal breathing is the heart of rest and digest, parasympathetic mode, getting us into that calm state that we want to be in.
I'm so glad you said that. Yeah.
And when we're not nasal breathing and we're mouth breathing, right off the bat, you're always in this anxiety prone, let's go, inability to relax mode.
Yeah. So if you are a mouth breather, let us know in the chat. Are you a mouth breather? Are you a nasal breather? And, if you're a mouth breather, it probably means you have higher, not necessarily higher amounts of stress, but higher levels of metabolic stress. So your body is not functioning the way it needs to. You're not getting enough oxygen deep into the tissues. You're basically like hyperventilating, and that creates a high level of acidity in the blood, which leads to a whole bunch of other health issues. So are you a mouth breather? Are you a nose breather? And, Dr. Sue's going to be on because she's going to be on again, because she and I have so much to talk about, and we need to have this conversation about mouth breathing, nose breathing, sleep apnea, just chronic health issues, and how the two of us working together can really make dramatic impacts in your health. So Was there anything you wanted to add to that before we move into talking about Lana?
No, I think that's good. It's a nice little overview, you know.
Yeah, perfect. Okay, so you guys are going to meet Lana. She's going to come on here shortly. Lana is a patient of mine, and I sent her to Sue. And Lana, I've been doing a lot of work. I do a lot of work with TMJ. So a lot of jaw work, restructuring of the spine, restructuring of the jaw. What I will say, I was telling Sue this earlier offline, was that one of the most important things I believe with chiropractors and dentists working together is that most dentists, excluding Sue, most dentists look at just the head from here forward, just the mouth, right? Just the mouth from the jaw forward. Most chiropractors look at the spine from here back. And so all of this gets ignored. Well, this is all one thing. And so working together, so I look at the jaw, I look at fillings when I take x-rays. I look to see if there's any oral tethers in there. I am working to make these connections so I can get them to Dr. Sue, because I know that if we can work together with these people, that we're going to make a really dramatic impact. So Lana is one of those people, and her jaw was giving me fits. And I finally said, you need to go see Dr. Sue. So she came to see Dr. Sue, and it's been amazing. So I'm going to let you tell everybody what you found with her while I let the dog in. And then, we'll talk about what we did with her and how we've changed her life. Like, it's amazing, incredible. So go.
All right. So Lana presented as this lovely young lady, but a lot of head and neck tension, a lot of difficulty breathing. She just had like a real tense look about her. And she was in pain, her shoulders, her back, and she was having a lot of TMJ problems. She had ground her teeth down, which is another one of the things that we see when we're not breathing well. So we discovered that she had a grade 3 tongue tie, which required some myofunctional therapy, which is essentially physical therapy for the tongue and the muscles of the face. And she was just right on board. She did her exercises. The therapist called me and said she's ready to be released. And she came in, we did her release. She had also scheduled for chiropractic adjustment right after the release, and also some craniosacral therapy. So all these complementary therapies really give us the best result. I think the one thing that I'd like to share with everybody is when somebody is looking for having perhaps a release done or evaluated, if somebody says, oh, you do have a tongue tie, let's release it today, let's take care of it, you got to just run, because that is not the way to do it. This is a multidisciplinary approach, and you have to have collaboration with the right kind of people to have a great outcome. And when Lana comes on, you will see what she had to say, and hopefully you can play her video, because that really tells a story.
Yeah, I've got to see how I can get it over onto my computer. Oh, no, you know what? I think I can share my screen and play it off of her Facebook page. I think I'll do it that way. Yeah, it's so, and I think that's really important too, because like I had a patient the other day that I was telling you about, working with her jaw, and she, I said, lift your tongue, let me see what's going on. And I said, you need to go see, my friend, Dr. Sue, to have that evaluated. She's like, is she going to cut it? And I go, no. And so to Sue's point, there's no harm in getting it evaluated, but you have to have the right person. It's just like anything else. You have to have the right person. And that, you should not walk in anywhere and have them say, oh yeah, let's just cut that right now, because there is a lot of preparation. The myofunctional therapist works to help get you stretching the tissues, opening it up so that it's easier. Your rehab is easier. It's so there is a process. And I mean, it was weeks before the final release. So think about it that way. Everything takes time, and you've got to be able to give that some time. She came to me the day of, and I'm gonna play her video here in a minute. And it was amazing. I could already see, because her jaw was really tight and kind of hanging up on one side, actually the left side. And I could already see that the jaw had released down just by releasing the tissues in the mouth. Her jaw was already, now it was still pretty wonky, but I didn't expect her to come to me and have it, oh, now it's perfect, because now the real work begins. Now we have the opportunity, we've got the flexibility, if you will, of the oral cavity, that now we can get all of those tensions to start to release over time. And you've heard me talk about this before, is that traumas also get trapped in tissues. And I know a lot, and I'm sure Dr. Sue knows a lot of Lana's backstory. So it's going to be a while before these traumas get released from her tissues. So again, just because she had that done today, it could be several months, a year, it could be years before she releases the emotional part of those things. But that's what we're going to be working on with her on, to make sure that all of that release can have its greatest benefit. So did you want to add anything about that?
No, I think you said it perfectly, that fascia does not get the respect that it deserves.
Mm-hmm.
It is our communication highway. Fascia covers every single muscle, every single ligament, bone. It is just connected to everything. So, and it does hold a lot of trauma, birth trauma, pre-birth trauma.
Crazy, right? I mean, years of stuff. So I'm going to see if I can get this to work. I've never done this before. So, so let's see. All right, here's me giving her her adjustment right after, but this is literally right after.
Can you turn it up?
Can you hear it?
No.
Wait a minute, sorry, over here.
You can't hear it.
Can't hear it? Okay, hold on. Can you see it? Can you see it? Okay.
Yes. So here's that emotional release we were talking about.
Yeah. I don't know how to get the volume to, is it here? Yeah, I don't know how to get the volume to, but I'll just play it. So at least you can see it. You can see her emotional, you can see what she does.
So what she was saying is that she feels like she's just taken off a tight dress, and she's asking, do people breathe like this? Do normal people breathe like this? And now she is going to do her mobility exercise. She couldn't even touch her toes. She couldn't even, basically, she was just touching her ankles. And she's like, wait, what's going on? How's this happening? And then she gets in the chair and she does that again. And it's...
I just turned the volume down so you could narrate it. Yeah, and she said, is this what it means to breathe?
Yes.
She was like, yeah. Yeah.
And right away she said she could feel a softening in her face and in her neck and shoulders.
Yeah, see, I can see on that left cheek, I can see there's like a dishing in on that left cheek now. Like it was just a release down. Yeah, and she's...
Yeah, and she's... She's like, it just feels so different.
Yeah. I mean, I could tell immediately. Her jaw was more square when she came in. So it wasn't, didn't have that like, it wasn't like pulled back. It was kind of pulled back before. So it was like it released and was starting to migrate forward. And now as this she's going to reach her toes.
So when she did that before, she couldn't even touch her toes and her legs were lifting up. And now she's going past and she just cannot believe it.
Yeah. Look at
And
her. She's so cute.
she texted me the next day saying, I didn't realize I had a speech impediment. I just talk differently. She says, I went to my singing lesson and they said, what did you do? You sound different. So all
Um,
these seemingly unrelated things.
yeah. And then she came to me, got one of the best adjustments I'd ever gotten out of her. Um, and I was just narrating again, just talking about how you can see. I wish I had a picture of her before. I probably do somewhere, but you can see how her jaw is more squared off here. Before it was pulled back and kind of recessed. So that was an immediate change that I noticed. And when I adjusted her, it was like it was like a freaking explosion. It was crazy. Um, so okay, I'm gonna stop sharing this. There we go. Yeah, so you can just tell by her
Right.
expression. It
Exactly.
really is. It really was crazy. And so I think this is why I wanted to make sure we had this conversation because so many people don't even know. So this is where, again, like for Sue and I, having and even the mom of the young teenager that we were talking about, it's like that was obvious to everybody, but it was they were working with a medical model that is very much inside the box thinking. And so there are things that if it doesn't, if it doesn't fall, if it's not right within this, these parameters, then the answer is no. You don't have X, Y, or Z. Where when, as holistic practitioners, Dr. Sue and I both, we look at all of the things and everything that we look at, we don't whittle you down to a piece and a part. It's like she's not looking at you as just a set of teeth or a tongue. She's looking at your body, and there aren't too many dentists that do that. So, and I think most of traditional medicine out there, and this is why people walk around struggling with their health for so many years, is because they're whittled down to a piece and a part. You're a heart, you're an intestine, you're a reproductive organ, you're a thyroid, you're a shoulder, you're a wrist. There's no you're you go to the ENT, you're a sinus, you're an endocrine part. There's and if you don't fall within the parameters of that person who you're seeing, whose specialty is the piece and part, then there's nothing wrong with you. So as holistic practitioners, we are trained to look at everything. And I don't know an ounce of what Dr. Sue knows, but I know enough to know when I need to send people to her. I know enough to know when I need to send people for an MRI. I know enough to know when I need to send people for other therapies that I don't have in my office. And that's how she is as well. So, so this is really, you're looking for people who are going to be on your team for your healthcare, and not just, not just whittle you to a piece and a part, or like hoard you, and you're like, I need something more. Well, we know we're going to be sending you and utilizing a team of people to get, this is all in your best interest. Are you there? Did I lose you?
No,
Oh, there you are.
great.
Okay, sorry. I turned my volume down. I'm trying to see where Lana is here. So this work it's really fun. It's incredibly gratifying. What I found interesting. So as chiropractors, we look at the spine, we look at the nervous system. Everything comes down to the nervous system and the function of it, and is there interference to the nervous system? And when there is, the body does not work at 100%. Well, every segment in the spine goes to some part of the nervous system. Well, one thing I found out when I went to the Holistic Dental Conference is that you guys have, it's called a Merrick chart. You guys have a Merrick chart for the teeth. And I thought that was fascinating. So that also, can you talk a little bit about that and how when you see, let's say it's a root canal, or I don't know, they have a filling in a particular spot, how do you look at that and then make those other recommendations for other parts of their health?
So all teeth are connected to different organs via meridians, kind of like acupuncture meridians. And it is, if there's a problem in an organ, for example, it can show up in the mouth, in the tooth, and vice versa. So if you have an infection in a certain area, you can have pain in another area. Or, for example, I have patients with, not even infections, but something kind of hurts in an area. This woman just came in the other day. She had pain in a tooth that didn't even have a filling, and it was like, something's just not right. So I'm like, well, let's give you a little ozone in that area. So we gave her the ozone, and this pain that she had in her shoulder, this nagging pain, she's like, oh my God, what did you do? What did you do to my shoulder? I'm like, nothing. I just worked on that tooth. But that allowed the interference in that meridian to be resolved, which allowed that pain to be, relieved somewhat.
Yeah. So I always encourage people to, don't think of yourself as a piece and a part, right? So that's a fascinating story. I've got Lana here. I'm going to bring her up and let the dog
wonderful.
back out.
Okay.
She's
Yeah.
out like 3 times now. So
okay.
Hi.
Hey, Lana, how are you?
I'm great. How are you? I'm so excited to be here.
Yes. So we just shared your video, and I'm sure Dr. Paul is going to ask for,
I did watch it. It made me so emotional again.
Right?
We needed to get the volume on it. I couldn't, it was the first time I was sharing my screen, and I couldn't get the volume to work, but we got the video. But I think people could glean just the look on your face and how emotional you were. And so we wanted to bring you on because Dr. Sue and I are so proud to be a part of your healthcare team. And we're super proud of you for following the path and trusting in us. That's a big deal that you trusted us to get you in the right direction. And so we wanted to hear a little bit from you. So, tell us when we first started this talk of go get this checked, and, what was going through your head when you're like, what, this tongue toy, what?
I trusted you. I had zero doubt. I called right away. I knew I was in good hands. Before I forget, I want to say something that I feel like it's really important. The main insight that I got out of this whole thing that doesn't even have a lot to do with tongue tie release is that you don't know something is bad until you know that it was bad.
It's a great point.
When you are used to something and you live with that all your life or for a few years, you just don't know, and you feel like normal. Okay, yes, you feel like if everybody has it, well, I guess I'm fine. So if not my constant fatigue, I would not be so persistent trying to look for answers. That was my biggest thing, and that's like throughout my healing process, that's how I met you, and that's how it all started. And I'm very happy, excited. I've been crying a lot these past few days for no reason.
Well, and for somebody who has chronic fatigue, Lana is one of the most optimistic humans that I know. She's so positive. She's just she's a ray of light, and really always trying to lift people up. So you wouldn't have known, and she's young, so she's got that too. So for somebody of her youthful age to be saying that she was constantly tired, and on the flip side of that, people in their 50s, 60s, even 70s might be like, well, it's just age. I'm just getting older. It's part of the aging process. That's hogwash at any age. So thanks for sharing that. That's really, really insightful. And I think so many people get used to living, like you say, with pain, with fatigue, with chronic issues. they compartmentalize it, and you learn how to adapt. And so what's been some of the biggest so what's been some of the biggest things that you noticed then that you're like, holy crap, I didn't even know that I knew that I had that until I didn't have it?
Improved flexibility, barely any pressure in my jaw. My body is more relaxed. And speaking about energy again, I had some people say to me, something changed about you. You're so hyper. And I was like, I am not hyper. I just went from having no energy to having energy. and I don't know what to do with that, because sometimes I even have a hard time falling asleep, although my body is more relaxed. It's because I am so used to being careful with not doing too much to not feel exhausted, that now that I have this energy, I don't know what to do with it.
And are you sleeping better then once you get to sleep?
Yeah. I sleep better. It's a totally different thing. I breathe better. My flexibility is better.
More rested when you wake up in the morning?
More rested, yes. And I do, like I said, I feel like I'm getting a lot of emotional release. I have these things that I cry about things that I would not even cry about just for no reason. And it feels good. It's not like this ugly crying. It's just, it feels like I'm letting things out. Like you said, I shared with you, I was taking singing lessons, and literally right after, so we had the release done on Thursday. My singing lesson was on Saturday. So I had 2 days for the swelling to go away, and then I joined the lesson, and they said, well, you sound different. And there was another thing that I didn't, so English being my second language, I thought it was normal that I had to put a lot of effort to pronounce certain sounds. I was just, well, that's okay. I think my pronunciation is better than a lot of people. So I was like, cool, good enough. And now that I can talk more easily, I realize it's not a language problem. It was my speech problem.
It's so interesting. Yeah.
I did notice that it's just easier to say certain words. My voice is deeper. I don't know if you noticed this.
Yeah. I noticed your articulation.
Yeah, right?
Yeah, your ability to make certain sounds, for sure.
Yeah. And it's not that you weren't hard to understand to begin with, but I definitely tell, like, what a crazy observation, right? You think you have a language issue, and it's because
I'm a perfectionist. I was putting a lot of effort into mastering the sounding perfectly, but I was struggling a lot. I am, like, one of my things that are not helping me in life is that I don't show people that I struggle. And like, when you look at me, when you follow me, you think I'm having the best life possible. So yeah, it's been my struggle for the longest time.
Well, interesting you were saying that about the traumas, because I before you came on, I said, we know traumas get stuck in our tissues. And I said, I know, and I'm certain Dr. Sue knows some of your, the things, some of your backstory, I'll just say that. And that, we were saying that now that we've released the tension, now you can start to release those emotional things. And that doesn't happen overnight. So it makes all the sense in the world that you're having these moments where you're just like, just crying and releasing, because that's just how it's going to be. And it's so healthy that your body finally feels like it can let go of all the shit it's been holding on to. I mean, that's life-changing, right?
Yeah, that is another thing. I guess it's a more mental thing. Out of a sudden, I started wanting to be louder, to be seen, to be like, to show up. I've always been an expressive person. Like, you don't have to hear me my face says it all. But now I just feel like I want to be louder. That's why I, started joining these singing lessons. I want to do new things. Yeah. I never knew I like Andrea Bocelli. I spontaneously got a ticket to his concerts today just because I wanted this loud, like, I wanted this someone so expressive to be in their presence. And I just, yeah.
Oh, he's
so
great.
He's amazing.
Yes.
I never knew I would like something like this.
Oh, it's great.
Yeah. It just feels to feel so comfortable in your body.
Yeah.
I'm telling you, that's,
I love hearing
I didn't
that.
know until I knew.
Didn't know until, yeah. And that's just so profound. It really is. It's so simple and so profound, is that you don't know until you know, which is why I wanted to, bring you on and bring Dr. Sue on and just talk about, having a team behind you and encouraging you. But then again, it was your commitment to wanting to figure out what you didn't know, not knowing that you didn't know, right? So.
But trusting us along the way. And I think that's huge for any kind of healing. It's really important to feel confident and safe.
Yeah. You know what? I will never forget when you asked me to try to touch my toes. And my first thought was, how does she know? Because it's been my struggle all my life. At school, I was feeling so embarrassed that I was not as flexible as other kids. It was shocking to me that I could do it immediately after the release.
Right. Yeah. It's crazy.
Everything's
connected. Everything's connected.
Yeah.
And it's just so nice to see you just blossoming, It's lovely to see that. And just even the softness in your face. I just see all this, like you just look like you're coming into yourself.
I got a free facelift, by the way.
Right?
I said your jaw, I need to go back and look at like a pre-picture.
I'm telling you.
Because your jaw is now more square. It's like it's dropped a little bit and it's squared off. It's really amazing. Like your facial structure is changing. It's beautiful. Yeah. You were beautiful before, but
So thank you. That was awesome. It's just nice to be able to hear that from you,
So what are you telling people?
Well, I tell people who to go to. I share my experience. I am very open about it. I post on TikTok and Facebook. I shared every single step of the process. And I was actually very impressed that it was not difficult. I felt very comfortable about after the release. I had tongue swelling for about 2 days, barely any pain. I didn't feel like I had to take some medication for pain. The process, doing this is so worth it. So I try to share it with as many people as possible because I want more people to feel as good as I feel right now. Like, people deserve to be a little bit happier. So
everybody does, right?
Mm-hmm.
Right.
I had no idea.
Awesome.
I learned something in the process, which I had no idea about, the whole, like, the tethering of the cord and all the tissues that would prevent you from touching your toes. That was new to me. And all of a sudden, I like 5 more people popped into my head, and I was like, oh, that's why we can't get their flexibility on deck. So it's such a huge topic. And I know, like I said, we wanted to really come to you guys today to talk more on the surface level, but to tell this story and to talk about why we do what we do. We can definitely go more in depth in future episodes, but this was so important because this was just 2 weeks ago, Lana?
Not even, 2 weeks ago.
Or so, yeah.
On the 15th,
wow.
Mm-hmm.
Yeah. So just 10 days ago.
10 days ago.
And
Such a
and
big
Dr.
difference.
Sue and I have been so excited, and Lana's been so excited. So it was just really important for us to bring the 3 of us together to, like Lana says, share the story so that we can help more people, because maybe you just don't know that you don't know.
Yeah.
Right? So how's the singing going?
Amazing.
Yeah.
So the teacher says, first of all, my voice is deeper, which I already noticed. Everything I do when we practice, it's less effort. It just flows. I don't have to try. Even my breathing is better. That's why like when I try to keep up with the group and saying certain things that used to be difficult for me. Right now, it just flows. It's effortless.
Well, and I remember you telling me that when you took a deep breath, so after the release, you took a deep breath and you would cough. And
I'm still coughing.
Yeah. So
it was coming from up here, and I didn't know I was supposed to breathe in so deep, and I still have these moments where I cough. It's a dry cough, and I feel like, things are moving.
Well, you're exercising a new muscle. I mean, that's the biggest thing, right? So you'll probably be coughing for a little while until you build up that strength and that depth in your lungs. So,
but I can already hear it in your voice. You're projecting more. It's not coming from up high, but it's coming from lower.
I can literally feel it. I didn't know I was supposed to feel this way.
That's right. You were talking more from up here before. Yeah.
And when I was talking, these muscles right here would be so tight. I would just move my lips like this. Now that I talk, I open my whole mouth and everything is relaxed.
Yeah.
What was the difference? That was a pretty immediate change too, right?
Right away.
When you do the release. So how big they open their mouth before and after.
Yes, and we take measurements. I think you took a picture of that.
I do have that somewhere.
And we did a sleep study on Lana before we did the release. And after, she's had a couple of weeks of healing, we're going to do another sleep study. It's always nice to, compare. I love numbers and being able to compare them.
Tell everybody about the sleep study, Sue, and how simple that is.
Super simple. Go
ahead, Lana. Because
I thought it was a question for me. I'm sorry.
No, but I think it's great.
I mean,
go ahead, Lana.
Simplicity from the patient too is helpful.
Yeah, absolutely.
Super easy. There's this little thing you put it on your finger. You see, there is an app that you set up. So you click recording and you go to sleep. It's very comfortable, so you don't even feel it on your finger. And then when you wake up, you turn it off, and then you get the results. So it was very easy, and I'm super excited to see what the difference is afterwards.
And what were you measuring? What was being measured?
So we were measuring different things. One of them is how many times she wakes up at night. So there are different levels and different stages of sleep. So even if somebody's sleeping, the magic happens at the deeper levels of sleep, cognition and hormonal balancing and recovery. And if you are sleeping and you get aroused from that deep level and you just go up to that level, so you're still technically sleeping, but it's a respiratory arousal event. And if you're waking up anywhere from 10 to 20, 30, 50 times an hour, you never get to the juicy parts of sleep. So you're always running on a deficit of not being able to do what our bodies are designed to do.
So that'll be interesting to see then if she, how much fewer of those episodes she has, right?
Exactly.
Well, I'm sorry, I keep interrupting you.
No, go ahead.
So I have this ring that measures my sleep too. It's not as efficient, but it does give me, same thing. It does say
we all have Oura rings, don't we? Do we all?
Right?
Yeah. It was the best thing I bought. It was a little bit, I cringed about the price, but then when I see the results, even this Oura ring says my sleep is better, my resilience is better, that the quality of everything is better.
That's good.
My results before and after, it's obvious. You don't really even have to know what you're doing. It's like, it's literally it's right there.
Massive change, right? Yeah.
Mm-hmm.
And what about your heart rate variability? Has that shifted?
See, I didn't pay attention to that.
Yeah, look on there too. That should be a measurement too. So, that's amazing. I'm so happy for you, and I know that we still have a little bit of work ahead of us, but it's going to be you're going to find there's going to be so much more impact in your healing going forward. I love the emotional healing and the emotional releasing that you get to do, because Lana is moving into a new phase of her life, and it's like oh man, it's going to be game on. It is game on, right?
I was quite surprised by how my body processed this release. I think I mentioned probably a day after. So I would get these, it's a little bit embarrassing to say, but I would get a couple of seconds of heavy sweating once in a while for about 2 days. And then when I asked,
interesting.
I was when I was having this craniosacral therapy, I asked about it, and they said, okay, that's probably your hormones adjusting. And I would get body temperature change. I would feel hot, and then I would feel cold. It was a few days afterwards. Didn't really bother me, but I did feel that my body was, responding to that.
Yeah, integrating. You know.
Well, we were talking about how the nervous system is so tied to all of this, and you've got the vagus nerve, which is up there, which is responsible for rest, digest, and repair. So when you release that, you're going to affect all different parts of the nervous system. So it's probably, you're probably just getting a hormonal re-regulation, right?
Now I'm starting to understand why. So I'm familiar with a somatic exercise, nervous system regulation.
Uh-oh, we lost her. Where'd she go? Hold on. Bring her back up.
Oh,
there you are. Okay.
What was the last thing you heard? Because I kept talking. So
somatic exercise.
Yes. So I was digging. I was trying to use everything I can to.
Oops. Hold on.
What's going on?
Okay.
I don't know. Okay, go ahead.
Because I'm trying to say important information and it's trying to kick me out. So I was trying to find why I'm so fatigued, and I found these exercises to regulate my nervous system. And now I understand, after what you said, I understand why it didn't work the way it was supposed to work. I was still not regulated. It was getting a little bit easier, better, but it was not that. And now after the release was done, when I do it, I am so relaxed. Like I never knew it was possible.
That's fantastic.
When we did this craniosacral therapy Saturday, it was 2 days afterwards, I was so relaxed. I told her I was scared because I felt like my body was melting into the table. I didn't know it was possible to be so relaxed. At some point I was like, hey, do I feel my arms? It was that deep.
Wow. That's amazing.
It's amazing.
It's incredible. Well, I love that you're documenting your journey. I think you're going to be able to impact so many lives with your story, which is then going to be able to help Dr. Sue and myself help more people just like you. So I love this circular path and just being able to share, because I always say, and Dr. Sue is probably the same way, like we can stand up and say how amazing our work is and how many people we've helped, but until we bring people like you on and really show the proof of what it really means to really, help people authentically, we are in this working as a team. Our goal is the benefit of the patient. And we want to see we want to see life-changing results in you and every single person that whose lives we touch. So this is really, it means so much to me. I know it means so much to Dr. Sue that you're sharing in the way you are. So thank you.
Thank you for inviting me. It was a great experience, and I'm excited to see what's next.
Yeah,
yes, for sure. Can't wait.
Any parting thoughts from either one of you?
Well, thank you for having us on your show and allowing us to share our story about what we do, why we do it. And, we'll, again, some other point in time, discuss how we do it and how we can work together on helping people feel better.
So I do have a question. Suggestions on implants.
So it depends on the position, where they are, and your bite, but I prefer zirconia implants because they're not metal and they don't set off charges like other metal materials in the mouth. So there are a few doctors that are placing zirconia implants for me.
Bill is out in Ascota. I forgot, Bill. Sorry. I just know you live like an hour west of me. That's all I know. So, but you're not too far. We could get you in the right place, right?
Absolutely. Absolutely.
Yeah,
so you can just DM us or something. Yeah.
Yeah, for sure. Yeah. We'll get you in the right direction with that. Yeah. And, Owasso. Yeah. Ascota, Owasso, same thing. It's all
those O's. Yeah.
That's right. Yeah. So Dr. Sue is definitely, she's going to be on again. I think we'll probably bring Lana back on because we're probably going to want like an update on her, right? You guys want to hear how her story unfolds here.
The healing's going.
Yes, for sure. So we'll be back because there is so much more that we need to dive into because Dr. Sue and I are on a mission to help so many more people just like Lana through chiropractic and through holistic dentistry so that we can make sure that we're getting people the help that they need in the right way. So I appreciate you guys being on. Thank you everybody in the chat for any of your questions and for your engagement. And please share this out so that we can help more people. And if you didn't hit the thumbs up on the way in, make sure you hit it on the way out. And we'll see you guys tomorrow morning for Reset Monday. See you Thursday for Chiropractic is Sexy. And then right back here next Sunday. All right. See you guys. Bye.
Good night. Thank you.